Lancet COVID-19 Commission Africa Task Force is now appealing to vaccine-producing nations for emergency donations of up to 300 million doses in vaccines on the African continent. It comes as the infection rate, driven by the third wave and the Delta variant, has significantly climbed in Africa. For more on this, we're joined now by the co-chair of the task force, Professor Salim Abdul Karim. Professor, good evening to you, and thank you for your time on the pulse. What are you asking for our continent? What do we need?
Good evening, Stephen, and good evening to all of your viewers. We're recognizing that the situation in Africa right now is quite dire. Many countries in Africa are estimated to about 1/4 of all the countries in the continent are going through a third wave. And the third wave is proving to be much worse than anything these countries have experienced before. The third wave is more severe than the first and second waves in about 2 out of every 3 countries that the third wave is already occurring in. So one of the key challenges is we've got to try and get vaccines, especially to the elderly and into the high-risk populations like healthcare workers. So our goal is to try and vaccinate 20% of the population in each of the countries in Africa. And to do that, we've estimated that we need about 300 million doses. Now, there are already about 42 million doses in the continent. So if all told, we're probably looking closer to 250 million right now. We don't anticipate that we can get that from COVAX, which is what the original plan was, because the supplier to COVAX, the Serum Institute of India, is no longer supplying vaccines to COVAX because it's using manufactured doses in the local Indian context. So with COVAX no longer having access to doses, we are appealing to the rich countries, many of whom have large stockpiles because they bought so much more vaccines than they needed, to make those available to COVAX to supply to Africa.
So you're suggesting then, from what you've just said, Professor, these vaccine doses do actually exist. They're in a warehouse somewhere, hopefully being refrigerated, and they're not being used.
Yeah, so we know that at least 3 or 4 countries are sitting with pretty large stockpiles. The US is sitting with well over 100 million doses that they have no use for right now because their demands have been dropping quite drastically, and whereas their supply has continued at quite a high level. So that's just one example. There are other countries, Canada included, that have very substantial excess doses. And for me, the really unconscionable thing is to see how, young people who are at very low risk are being vaccinated in Canada, in the US, when we haven't even don't have doses to vaccinate healthcare workers in Africa. That, for me, is really an unacceptable situation.
It takes us back to the problem that we've been worried about around vaccine nationalism. This is not actually a financial appeal, it's a moral appeal. It's really about people's morality.
Yeah, and the point we were just trying to make is that even if we got money, that doesn't solve the problem, because if we got money, we have to buy doses. To buy doses, we join the back of the queue. Those doses will only come in December, the last quarter of this year. So we don't need the money right now, we need the doses. And there are countries with those doses, and we are appealing to them. We understand, countries don't want to give doses away because they're not sure about their own supplies, and they're concerned that if they give it away and then run short. So I can understand those. But there are countries that have far too many doses, and so we're appealing to them to really make those available to Africa.
Do you believe these countries are going to be listening? I mean, there are all sorts of ways that this can be done. I mean, in history, sometimes people have used pop stars. I don't know if that's the right way to do it. But are there ways to actually try and do this?
Yeah, so we've gone the route of 3 different ways of trying to encourage them to do this. The first has been to make this public call and making it, openly. The second is that groups of scientists have come together to amplify this message. And then the third is that direct meetings are being held with various countries. And the senior members of the Lancet Commission are part and parcel of that process. I have to say, I have to be optimistic in this world, and I'm hopeful that at least one of those countries would provide. I mean, even if they provided 50 million doses, that would double what we currently have available on the continent.
Professor Salim Abdul Karim, co-chair of the Lancet COVID-19 Commission Africa Task Force, I really do appreciate the time. Thank you.